Hello, everyone. Um, Thank you all so much for tuning in into this very important Facebook Live that we are putting together in partnership with amazing organizations that have also been working with their communities to ensure that we are releasing people from detention. We have the privilege of having BDS, the Brooklyn Defenders, who have been doing a really amazing work in New York City to make sure that people are in this moment being taken care of, especially those who are the most vulnerable in detention. We also have with us Doctors for America, who will be talking to us about what are the dangers right now of continuing to have people in detention. And of course, our amazing attorneys from Raíces, who are going to tell us a little bit of what's going on, what we have been seeing in detention, as well as one of uh, someone who will be sharing her story of why right now it's so important for her own husband to be able to be released, and really calling on all of us to do something, right? To really take action in this moment where all of us are really trying to be there for each other. So we're gonna go ahead and get started. Again, the topic of this call is to, or this live stream is to, one, share with you what's going on, share with you as Raíces, as BDS, as Doctors for America, sharing with you why is it right now so important to ensure that all immigrants are released from detention in this moment of a crisis, a national crisis where we have millions of people trying to figure out what to do, many people in cities where they're already forced to or asked to stay home, if I should say, asked to stay home because there's so much that we can be exposed to as far as the virus goes, getting sick, getting our loved ones sick, if we are coming in contact with the coronavirus. And so, as you can imagine, people who are right now in detention have no ability to really to take the precautions that they need because they are not given the tools to do so, and also um, they shouldn't be in there. And so we're making that case in this live stream. And secondly, we want to make sure that you know what you can do to support these efforts to release. And as we're using this hashtag to free them all, really, right now, in this really crucial moment for America, but also for our American community who's going through so much as well. So with that said, I'm gonna go ahead and get started. I didn't even introduce myself. I'm ERIKA ANDIOLA, and I am the Chief Advocacy Officer for Raíces. I will be moderating this live stream. So we're gonna go ahead and get started. The first person I want to introduce to you all is Donna Kim, who is a doctor from Doctors for America, who have also been doing really incredible work serving our immigrant community. Donna serves as the board member of Doctors for America and is on the Immigrant and Refugee Health Justice Steering Committee and Doctor of Medical Initiatives or Project Lifeline. They're running most recently their Asylum Collaborative in Matamoros. She has years of experience performing medical records reviews for immigrants incarcerated by ICE and advocacy around medical care and liberation. I'm going to open it up for Donna to share with us right now what they are seeing, what are the implications of keeping people in detention, and what we should be doing right now to ensure that that's not the case. Donna, I'm going to open it up to you.
Yeah, so I think this is super timely to have this live stream at this moment. We had been talking for probably at least the last couple of weeks about the threat that COVID-19 poses for really anyone who is incarcerated or in congregate care settings. So that includes anyone really who is in ICE detention, including in family detention facilities, people who remain in CBP custody at our borders, children who are in migrant facilities for migrant children, or shelters for migrant children, people who are incarcerated for low-level offenses in our county jails and prisons. There is tremendous overlap here in the risk for there to be rapid transmission and really infectious crises within these establishments. And we've known this. I mean, Human Rights Watch has been following deaths in ICE detention, for instance, for many years. And we know that since 2010, of the 52 deaths that we've seen, 23 of them were because of subpar medical care. Last year, we saw thousands of people who were quarantined for infectious to reduce or mitigate the risk of infectious spread of disease, including mumps, measles, influenza. So this is something that we've been aware of. And so physicians have been calling for the release of people who have been detained by ICE and also who've been detained in these other ways as well for a couple of weeks now, as we have seen that this crisis is definitely coming to the United States. And it's been devastating in other countries around the world. So yeah, I mean, these facilities also they're predisposed, right? Not just because they are closed quarters with poor ventilation and also historically poor access to medical care, but the conditions of detention themselves are very, very poor. And we know that if you're not getting adequate food, or if you're getting, food that is spoiled, and your basic physical needs are not being met in these facilities, that your immune system is not going to do well with infection. Yeah, most recently, I just wanted to share that I was in touch with a physician in the state of Texas who had serious concern that there was infectious risk in a family detention facility. And this was not around COVID-19, it was around varicella or chickenpox. But it does seem that those who are subcontracted by ICE to provide medical care in these facilities, that the standard of care being provided is subpar, and it's resulting in a lot of morbidity and mortality for people. So I wanted to share that. I don't know if you'd like me to stop there or to go on.
Yeah, thank you so much. I really appreciate that. We're going to open it up for questions towards the end, and I'm pretty sure folks have questions specifically for, doctors and right now, what is it that we are going to be seeing? So this is great. Thank you so much for sharing with us, Donna. I'm gonna pass it on to our staff from Raíces. And like I said, I'm gonna open it up for questions afterwards, where we're gonna be able to answer or ask questions on the Facebook chat. So if you do have any, please feel free to start putting them on there, and our staff from Raíces are gonna be taking those and giving them to us. Thank you so much, Donna. And so I'm gonna introduce Andrea Mesa. Andrea is our director of Raíces family detention team, and she is based in Texas. She works from the Carnes Detention Center with her team. She began her work with Raíces at Carnes as an Equal Justice Works Fellow in 2015. And she's going to be discussing the urgency to release our most vulnerable clients currently being held in family detention, and also immigrants in prisons in the state of Texas. Andrea, I know you're going through so much, and your team is going through so much right now, and I just want to be so thankful for you to be able to be with us right now. I'm going to open it up to you.
Yeah, thank you, ERIKA. I know it's a hard time for a lot of people, and most especially people who are in immigrant detention centers and prisons around the country right now. And so, as ERIKA said, thank you for that introduction. My name is Andrea Mesa, and we have a team of lawyers, legal assistants, and also our amazing data staff who serve the families at the Carnes Detention Center that's about an hour outside of San Antonio, Texas. And so our staff goes down in teams Monday through Friday to the detention center, and we provide legal services to the families who are there, but we're also advocacy and support for them too in the midst of everything they're going through in detention. And so we've seen a lot of changes at the Carnes Detention Center within the Trump administration. And I think a lot of the things that we've seen over the last couple of years make us very, very worried about the family population that is detained in Carnes right now and what might happen to them if they're exposed to COVID-19. over the since 2019 till now, the population, like I said, has changed a lot. Historically, KRYSTLE detained mothers and their children until 2018. In 2019, we saw that population change to fathers and their sons. And in most of the summer of 2019, we saw single adult women. And the reason that I sort of share a little bit of the history here is because some of the protections that are in place for families who are in immigrant detention, protections around the length of time that ICE can keep people in detention when children are involved, have meant that most families are released from KRYSTLE within weeks or months. And we haven't seen prolonged detention of families at KRYSTLE as a general trend. But when we had single adult women at KRYSTLE over the summer, there were no protections to get them out of detention quickly. So they had to go through their immigration proceedings in detention at KRYSTLE. And what we really learned during that time, what we knew it before, but we really learned it in this time, is that KRYSTLE is not set up to provide medical care for people who are detained for a long period of time. I think my theory, I'm not a medical professional, I'm just a lawyer, but my theory is that, because most families were in and out of KRYSTLE within a matter of weeks, typically, GEO, the private contractor that runs KRYSTLE for ICE, had just kind of been skimping on medical care, and it's just not an area that they felt there was a need to invest in because families were in and out so quickly. They could just ignore families' complaints and know that they would be out of detention within a couple of weeks, and there's no accountability there for them. Families, after they're released from KRYSTLE, go all around the country to live with their family who's here in the United States and their sponsors and loved ones who are willing to care for them. So it's been really hard to hold ICE and hold GEO accountable for all of the complaints we've heard from our clients throughout the years about the medical care at KRYSTLE. And when the women were there, because they were detained for months at a time, some of them 5 months, 6 months or more, unfortunately, we know some of them are in detention in other detention centers months and months later, coming up close to a year now. What we heard from them as the months and months at KRYSTLE went on was that their medical concerns were going completely unanswered. We know that there's not an internist, an OB-GYN, there's typically not an MD on site at KRYSTLE. There's usually just nurses who are there and do very basic checks on people and then tell them to drink more water, to take ibuprofen, to eat more food, very basic things that meet, in my non-medical opinion, no standard of care. And so we're hearing the same things from the current family population that's at KRYSTLE. Right now, the families there are full family units, meaning full nuclear families, so mom, dad, and kids, sometimes multiple kids. We know that there's several pregnant women at KRYSTLE, and there's lots of babies, so infants who are under 1 year old, under 2 years old. And this is the first time in a long time that there have been children this small at KRYSTLE. It's also the first time in the history of KRYSTLE, as far as Raices has been working at KRYSTLE, that I'm aware of, that there have been pregnant women detained for an extended period of time at KRYSTLE. And we've asked ICE about this multiple times because under the previous presidential administration, there was a general unwritten policy towards releasing these more vulnerable populations, so babies and pregnant women. And ICE has made clear that there's no such directive anymore, and so there's no authority telling them that they need to be releasing these vulnerable people from detention. And so with all of this, with the current population, with the numerous reports we're hearing from families of sick children, what our staff is seeing, that almost all the kids at KRYSTLE are showing signs of respiratory illness. They're coughing, they have runny noses, they're not eating well. The parents are reporting to us that their children are losing weight. These are across the board complaints that we're hearing all the time and over again from our staff. And so we're really concerned about their vulnerability to contracting an illness if there were to be someone who enters a detention center. who is exposed or who is a carrier of it, and also especially the ability of the medical staff there to care for anyone who may have this illness and what to do if there's an outbreak. Karnes City is about an hour outside of San Antonio. There's not a major hospital in the area, in the immediate area, so we're very concerned about the county's capacity to handle a medical crisis if one were to arise. And the precautions that are being taken, from what we can tell, are taking the temperatures of people who enter the facility and asking them a questionnaire about who they've had contact with and if they've traveled. And as we know, especially here in Texas, what we're seeing is that some of the cities are getting more access to tests for COVID-19, and we're seeing that the numbers of positive test results are going up in the surrounding areas in Austin, San Antonio, Houston. And so we can just expect that to continue. And, you know, the staff are coming in. Our legal visitors, we're trying to limit our legal staff going to Karnes, but there's people coming in and out. And we just worry that it's only a matter of time until there's a positive test result within the detention center.
Thank you so much, Andrea. And I just want to again emphasize that this is real people who are going through a lot of concern right now. And if I may just add one more piece of information that, you know, Andrea from our team was sharing with Raíces, is that a lot of people are actually hearing from the news what's going on with the virus rather than hearing them from guards on what they should be doing, and people getting asked to, you know, in other detention centers to wash their hands with shampoo because they don't have soap. So a lot of you know, just really big concerns that families and individuals have in these facilities. So again, thank you so much, Andrea, for your work and the work that our, you know, family detention team has been doing to protect our clients and the people who are the most vulnerable. I want to pass it on to we have two Andreas on the live stream today. Andrea SAENZ. She is she works for the New York Family Immigration Unity Project. She is the first public defender. Oh no, the New York Family Immigrant Unity Project is the nation's first public defender system for immigrants facing deportation. And that is defined as those people in removal proceedings before an immigration judge. Andrea is the attorney in charge of the NY. It's a really long name, so I'm just going to the New York Immigrant Family Unity Project team at Brooklyn Defender Services. And she's going to talk to us a little bit about what's going on in New York, as she has also seen some of the conditions in the detention centers there, what clients are going through, and what we should be doing right now to ensure that people are not put in this position. Andrea, I'm going to pass it on to you.
Thank you, Erika, and thank you, Andrea and Raíces, for all the work that you're doing to help folks on the border. We really appreciate it and love partnering with you. And I'm really glad that we can shine a light on the folks that we defend in New York State. New York City is the busiest immigration court in the country, and we have a lot of people to be worried about right now. So the danger facing immigrants right now is on the border, and it's in the interior, where immigrants are imprisoned every day in detention centers. So like Erika said, I'm also Andrea. I'm the attorney in charge of the Knife Up team. That's our acronym at Brooklyn Defender Services. And we represent detain people who are facing deportation in New York City. And what we are seeing and hearing in this area should scare all of us, unfortunately. The first thing that's happening is that ICE raids and deportations continue, and they're endangering community safety. So ICE is continuing to arrest people at their homes and on the street, despite a global pandemic and state and local orders for people to stay home. And they're taking advantage of that. So we are seeing people arrested at their homes. As recently as this morning, we had a client arrested at her home. So it is really terrifying that that's happening. This is all part of something that ICE is calling Operation Palladium, which is an interior enforcement operation that is politically motivated. And that's not my opinion. They have said that they are doing this operation to target quote unquote sanctuary cities. So you may have seen on the news that ICE also arrested people in Los Angeles a couple of days ago, despite them having state and local orders for people to stay home and clear the streets. So this is not about public safety, it's about trying to punish jurisdictions that have progressive policies, and they're doing this in the middle of an incredible health crisis. So ICE could release all of these people on recognizance, on check-ins, or on a bond, but instead they're detaining all of them. And of course, that is further crowding the jails, which is incredibly dangerous. Our detained court dockets are bursting at the seams. You may have seen that the immigration court, after a lot of public shaming, has closed down the non-detained dockets. They've not closed the detained dockets. They are going forward. And it's not just that they're going forward, but we're seeing new people show up on the dockets every single day. And we are trying to intake those clients. It's really hard. It's heartbreaking to see how many new cases are on the dockets every day. The judges themselves are very concerned. They're upset that they're asked to be in court 5 days a week. They're trying to restrict their contact with us. This is unconscionable, and it's dangerous for all of us that ICE is terrorizing communities in the middle of this crisis. They're scaring people away from accessing healthcare. They're taking parents out of homes where children are home full time and need care, and they're crowding the jails. So that's why enforcement must stop. And you know, if they turned on this hose in January when they started this operation, that means that they could stop it overnight. It would be very easy to do that, and that's what they have to do. The second piece, besides enforcement, is that the detention conditions themselves are inhumane and they're getting worse. So ICE detains over 50,000 people a day right now, which is just amazing to think about how many people that is. That's up from during the Obama administration, it was about 34,000 people a day. And those of us who remember those days, we organized around that being too many people in detention, because it was, and then it got worse. If you kind of think about it historically, there was a time in the 90s where we detained under 10,000 people a day. And so this is not normal. We don't have to do it this. In our area, ICE contracts with county jails. So all of our clients are held in county jails in identical conditions to people who are there for criminal charges or criminal sentences. And they all have their own practices that are changing daily in response to this crisis, which is further adding to the stress and confusion at this time. So on a normal day, clients get substandard medical and mental health care, and Donna explained that very well. They don't get enough food. They have problems calling their attorneys and counsel. That was always the case. And I know KRYSTLE has a lot more to say about that. And now we're hearing a lot of really concerning things, including access to soap and cleaning supplies, having to buy soap from the commissary. And right now, at several jails, clients are being locked in their cells almost the whole day. It's like solitary, but if you had a roommate for two people, which of course is also not social distancing. So people are being locked in their cells from 16 to 20 hours a day. Some people were actually moved from more open dorm type settings to actual cells with, locks, using a toilet in the cell. Remember, this is supposed to be civil detention, but it's actually punishing people and it's putting their lives at risk. So we have a lot of very vulnerable people who are detained right now, clients who are over 60, who are HIV positive, who have immune and respiratory issues, hepatitis, asthma, mental health needs. These are things that could be managed in the community, right? They're not life-threatening on their own, but they're not getting good care in the first place, and they're at high risk if they get COVID-19. So the other thing that's happened is that contact visits have ended, and then jails have started ending even non-contact visits. And we understand why they're doing that, but what that means is that we are not able to access our clients because they're not also letting us call our clients or having the video systems work. So we've been fighting for a way just to communicate with our clients. And I know KRYSTLE can speak to the incredible communication difficulties as well. So we have a few clients who have money on their accounts, can call us occasionally and tell us what's happening. They're telling us they're scared, they're worried for others. They're asking what's happening to us. These are caring people who don't have to be there. So I will end with what we are doing in hopes of getting people out. So we've been filing individual release requests for our clients. We have started filing lawsuits. We've started filing federal habeas corpus petitions to try to force someone to look at these clients who have high risk factors, whether it's ICE or the federal courts, So, you know, at this point, ICE is on notice of which of our clients are high risk. They can do the right thing. They can release KRYSTLE's husband tomorrow if they want to, and thousands of other people. They can go home. So we're talking to press, we're talking to you all, we're talking to elected officials, anyone who can call on ICE or change their funding or change their directive so that they have to do this. Because really what it's going to take is it's going to take mass releases to keep people safe in jails. And that can happen. That can happen safely. People can be released on recognizance, on check-ins, on all kinds of safe alternatives to detention, and ICE has to stop arrests. And the other thing that I would suggest that people do if they really feel like they want to help is to donate to a bail fund to get people home who have been granted bond. So there's a wonderful one in our community, the New York Immigrant Freedom Fund. RAICES has a wonderful bond fund. And that's a way that we can get a couple more people home.
Thank you so much, Andrea. And also thank you for your work, and thank you to your team for your work in this really incredibly stressful moment. And as you all know, this is not only stressful for people who are in detention, this is also something that is really weighing on the families of people who are in detention. And if you could imagine, you know, not knowing if maybe your mother who might be in a different house, you know, is being taken care of because you can't go, or you want to be, you know, quarantined, you're social distancing, as they're calling it now. Imagine having somebody who's in detention who you don't even know if they're being taken care of. So with that said, we want to pass it on to KRYSTLE, who is someone who is going through this. She's a mother of 4 whose partner, Steve, his name is Steve, is in immigration detention in Orange County Correctional Facility in New York. Steve's is being represented by BDS, and you know, we know that KRYSTLE has been in contact with Steve and others in the facility daily by phone, so she's going to share with us a little bit of what she's been hearing from her husband, and also, you know, what she's really asking us to do at this moment of crisis for all of us. So I'm going to pass it on to you, and thank you so much for being on.
Good afternoon, everyone, and I thank you so very much for allowing me, first of all, to even be a voice for what's really happening in this whole nother world, because there's a whole nother world of people, of husbands, of brothers, of cousins, of just loved ones who are going through exactly what we're going through out here, but just on a different scale. Now, I'm a mother of 4, yes. My mom was the head nurse, registered nurse at Methodist Hospital until she developed lung cancer that metastasized to her brain. So she now is also part of my household. So I take care of my mom. I am a registered nurse who's not working right now as a registered nurse. I was in the midst of taking my boards and my studies and things the like. I had just finished having 2 children. Steve and I just moved up here to Dutchess County, and we were trying to start our life. And then the second week of school last year, immigration came to our home. He put the baby on the bus, and right when the bus doors closed, I was looking out the window, and then they walked up to him, and you know, he said good morning. He had no idea they were there for him because he was working on the books. He's working for Marist College at Salsa Fresca. He was a chef there. So he didn't run or anything. We let him in. We thought that if we spoke to them and we showed him pay stubs and stuff, that they would just leave. And that wasn't the case. They told me that he would be home within 2 weeks. And it's now been about 7 months. And I haven't been able to go back to work fully. I have 2 private care patients now. I had 3. One of them has been hospitalized last week for the flu, so I lost that income, and I also lost a good patient that I used to speak with a lot. So I still go to the hospital to see her, but that's not a part of my daily schedule anymore. So if I have to get up and run right now, it's only because the kids are probably doing something that they're not supposed to do. So please forgive me, but it's been really hard, you know, and I speak to Steve at least 4 times a day, usually prior to this COVID-19. I used to visit him at least 2 times a week. He's about an hour away from where I am. And that's on a good note. From what I was hearing, you know, there are people who've been taken to other far places. So I was actually grateful for him to be only an hour. And then what happens is I have to check in about 40 minutes before we go. So the process of getting to see them was already difficult. And I want to expand on what Races was saying that's going on in Texas. Like, yeah, and also what Andrea was saying from BDS, the medical care was already hard because back in November, Steve he has an underlying he has a heart condition due to an underlying issue. And so he already has a compromised immune system. He was taken to one of the local hospitals near the jail back in November. They said he had an irregular heartbeat. He was complaining of his chest hurting in the cell. And this is something that we didn't quite get a handle on when he was outside, because although he was working, they kept on denying him medical care. Every 30 days, he would have to redo his medical insurance. So the cardiologist and neurologist that was needed for him to see, he couldn't really get full appointments with them, because right when, you know, it's just a timing thing and a lack of really medical care thing. So now that he's in the jail, they did take him that time to the hospital. But when he started complaining a couple days ago about his chest tightening, what he was told, he called me. He was frantic, and he called me and he says, I said, what's the matter? You know, why are you talking like that? What's the matter? You know, did you just wake up? He says, no, my chest hurts. So I said, well, did you tell the officer? He says he told the officer, and they told him that the medical unit is crowded. The medical unit is crowded, and they have an influx of patients down there, and they're only catering right now to flu-like symptoms. So they said that they could call EMS for him, but that the local hospital was also, which is KRYSTLE Run Medical Center, which is near them, maybe go for 30 minutes. They said that they had a previous inmate that tried to go there, and due to the fact that the officer must have had to stay past their shift, and they kept having to send officers there, and they were already shorthanded at the jail, they were not able to let the inmate stay in the ER because the ER was too crowded and it took too long. So they had to bring the inmate back. So long story short, the regular issues of daily activities that some of the inmates may be exhibiting, diabetes, you know, high blood pressure, my husband with his heart disorder, and this another inmate has disclosed some information to me just the night before last. The problem is they're not able to get phone calls from their family members as much as they used to anymore because of the lockdown that's being taken place. A lot of family members aren't able to get out to the jail. Now the jail has now inevitably locked down Monday. That's where you're able to go put money on the inmate's phone so they can call you. Now the jail is closed, so now you have to go to a Western Union location. But a lot of the Western Union locations are also closed down right now. So a lot of the family members who don't even speak English, they don't know where to go. So now they're coming onto the call when Steve calls me, and I speak a little bit of Spanish. So they know now that I'm a bit bilingual. So now they come on the phone, and I feel so bad for them because they don't know where to tell their family members to go. And they just want simple questions answered, like, can you put money on the phone? Can you call and let them know? Can we have hand sanitizer? Steve said that the officers all have hand sanitizer as per, I guess, their jail rule that says that all employees must walk with hand sanitizer. So now what they're doing is they're patronizing the inmates with these hand sanitizer, stating to them that it's only for their use. It's not for the inmates. Steve described it as being like a scary movie, like they're in a bubble and they come into their bubble garbed up with their gloves, and they're asking which inmates, and they're pretty much antagonizing the inmates with what I would call, in my medical field, reverse psychology. If you take this mop and bucket and you do this work, then we'll make you a trustee so you can get extra food at the end of the, you know, things like that. To me is sheer manipulation as to you not wanting to perform your job duties. But I'm sorry, guys. I have to open cheese. Give me 1 minute. From Malachi, yes, that's Mr. Shark here. I'm sorry, give me 1 minute. If I give this to you, can we make a trade? Fair trade? I'm gonna go upstairs. Need 10 more minutes on the phone. All right. Good job. Look, it's totally open. You're in charge. I need you to tell all the young ladies they can only have one slice, okay? All right. 1 minute, 1 minute. There you go. And tell them to wash their hands when they're done, okay? All right, you're in charge, remember. Upstairs. 10 minutes. 10 long minutes. Okay. So he says that there was I asked him, I says, well, you know, first of all, medical field, we're always taught that there can be and prepare for any emergency, right? So you got to be understanding to some of the employees sorry if you can hear me, some of the employees that are working there, they may be stressed out as well, going through their own things at home. You know, they may have children, they may have families. They're bringing what Steve expressed to me. He says, Crystal, I know you're going to tell me. I know what you're going to tell me. Take it easy with everybody. Everybody's trying to cope, which is true. Everybody's trying to cope. But he says, Crystal, their coping mechanism is us. Like, they're coming and they're taking their anxieties out on us. Like, it makes them feel better to let us know that we're not entitled to these disinfectants. We're not entitled to gloves. We're not entitled to protect ourselves, because as if we're the issue. And we don't even really know what's going on out there, because on certain days, we're not allowed to watch certain television shows or certain live streams or certain news episodes that are not pro-Trump, pretty much. He says that they choose what we watch, they choose what we eat. And now I asked him, I said, well, since we've spoken on the phone, has there been any changes? He says yes. As one of the inmates sorry about that. As one of the inmates had confided in me and told me his situation, he says he has hepatitis C. And he also has a failed liver. However, because he has opted out to mop the floors, have made him a trustee, and now he's in charge of serving the food. He's in charge of distributing the food on the unit. So he expressed to Steve that he's a bit concerned, because now what if he comes into contact with his weakened immune system with someone else who may be exhibiting signs and symptoms that hasn't gotten the chance to be checked out yet because of their overcapacitated infirmary. So now I'm stuck between where it's like, if Steve was home, I could go out and work 12-hour shifts. I could be hands-on. I could go volunteer where I need to be. I could go get out there. I could help where I need to help. But I have my caregiver, which was Steve, because my mom, who's also ill, is in a wheelchair now. My mother was head nurse to the recovery room, but everyone has a time when they must need help. Once a man, twice a child. So now I have my mom here. Steve used to care for her while I go to work. I can't do that. And I just feel like I'm in such a stuck position where it's like, I don't know where my finances are coming from next now, because I haven't been able to get out as much as I'm used to. My son, he exhibited, he had the flu about 2 months ago. He had 2 seizures. The one that you just saw, 4 years old. He had 2 seizures. My daughter had 104 fever. I was at work with one of my patients. I shot home, but the purpose of me shooting home was kind of, I was dreaded between having to choose which child I had to take into the ER, because I brought both of them with me, and the nurse looked at me and said, I can only let you come into the room with one. We need another adult. I told him, I said that my daughter, my eldest daughter, she's 13. I said, she can stay if you put them in a room right next to each other. Can I bounce back and forth? She said, no. So I called, I called the next very best place I knew to do. I called my pastor's wife and I asked her if she could come. And I had to innately go home with the kids, wait for her to come. And then I was able to get to the hospital. By that time, Malachi had another seizure. The ambulance came and picked me up. I had to leave Madison home with my mother and wait for her pastor's wife to come. And in that time, I'm just grateful that I didn't lose any of my children, but I also know that I need more hands on deck at home. Like, I need more hands on deck at home. And Steve has already seen a judge. They denied his bail. And the only reason they denied his bail, the judge said, is because he qualifies for other reliefs, which now we're just in the process. And his lawyers are awesome at BDS. They've been awesome in trying to help to keep, keep our head above water and to just keep us positive with the case. Because when I heard the judge say that, it made me feel hopeful, but now we're in the waiting process. And while we're in the waiting process, a deadly disease or a deadly virus is now going around, where I feel like if we're in the waiting process, can he be on house arrest at home? We're not going anywhere. We'll be right here when you're looking for us again. But could you just make him come home so that we can keep this under control? And I think if I'm feeling this way, and I'm not saying that I'm the only one feeling this way, there's got to be other family members like whom I've spoken to on the phone that are saying the same thing. Like, we're going to figure out the way. We'll figure out the relief as to what they may qualify for. But in the meantime, can they come home in this drastic time of trying to contain this disease? Because if one of those men catch it, they can easily give it to others, being that they're the food handlers, being that they're the mop cleaners now, being that they are confiding in one another and they're congregating in there. If we're supposed to be out here saying, the easiest way to not spread this virus is to keep it contained and everyone stay home, then we should have those young men also go home, because they're definitely, from what I can hear, congregating in there on a nightly, on a daily basis, because they're overcrowded. They don't want to send any of the new ones who are coming from Westchester. My husband also told me that apparently he spoke to one of the inmates that said he just came from Westchester County Jail. Westchester, apparently there's a case of COVID-19 there, and they are now overcrowded. They're overcapacitated there, and they're sending inmates to other jails. Now, usually what the process would be when you come into a new facility is you are in the infirmary for 24 to 48 hours so that they can, you know, test you and get you, as they call it, registered into their system. Inmates are not being fully registered now because there's nowhere to put them. They're now taking these individuals that are coming from other, you know, other facilities into his facility, and they're housing them on the immigration unit until they see the infirmary and get cleared to go into population, which I just think is just such a, I just think it's such a slap in the face to even the immigrants. I just feel like there should be just a specific unit still for hospitalization. And I did hear that on the news that they're trying to open up certain, you know, college dorms for infirmaries and things like, but in the meantime, there's people suffering with this. There's really people suffering with this. Their next door cellmate who they share vents with and are only separated by bars is coughing, complaining, spitting on the walls. Hey, can I get something to clean? And he says that they shoved the bucket in and says, you can clean it. And they gave him body wash to pour in the water of mop water to mop his room. Dial body wash. That to me is just a disgusting, inhumane way of trying to, you know, quiet a situation. So I'm just very grateful to be on this panel. I'm sorry to hear that there's even children that are going through this in Texas. That's what's disturbing my heart right there, because my husband alone is disturbing me. To know that there's children that are living in those types of conditions, I'm really hopeful that something can be done like soon before that becomes a problem, because at some point, what are you going to do with all those individuals that are incarcerated? You cannot just dismiss them. They need care, and the proper care is not going to be able to be given in the facilities that they're being housed in. So thank you.
Crystal, thank you so much for sharing your story. And I'm going to take the privilege of speaking for everyone that we're really grateful that you took the time to actually share what you're going through. And I'm just also going to take the, I'm just going to say that I think you're just such a warrior, such a, you know, strong warrior who's right now looking out for so many people. And I just want to say that we're here for you. Thank you so much for sharing.
Thank you for saying that, but this is probably the most honest thing I'm going to say all day. Like, I keep hearing that I'm strong and that I'm a warrior and stuff, but I'm not going to lie, like, it's getting bad, and I'm starting to feel like, I'm hoping somebody can hear this, because like, I know there's other women or even probably men that are waiting for their wives to come home that are so overloaded with trying to just be a good person in society, where it's like, I'm really hoping that something can get done, because I'm getting overwhelmed. It's an overwhelming situation, you know, and you know, the strength is there, but I hope I'm not lying to these people. Like, when they speak to me on the phone, they find courage and they find strength, but I'm hoping that I can give them enough strength to say that, listen, you know, I can get something done here. I don't know.
Absolutely. Thank you so much for sharing. And that's why we're here. We want to find a way. And I think we're all trying to figure out what those ways are to help, and to be able to push for those who do have the power to do something, to do, you know, to do what they can in their hands. So I'm going to make a quick call to action for everybody. And again, I want to just thank all of our panelists for, you know, sharing and your expertise. And I know right now everybody can be doing a million things because there's so much to do, even if we're in our own homes. But I just want to also make sure that we do have some direction for people who are looking for some directions of you know, things to do, and also be very upfront that we're also strategizing as we go. We're trying to figure out what's the best way to continue to pressure people with power. So there's two things that I can definitely tell you that you could do from home. One is to sign our petition. From Raíces, we created a petition to pressure the local ICE director in Texas to release people who are right now at Carnes, at Pearsall, and at every detention center because if they have the power to do so before things get worse. And as we heard from our panelists, there's a lot of worry internally and externally from these facilities. And so our social media staff from Raíces are going to share the link to our petition. And the second thing that I wanted to share with you all is that there's other organizations who are also doing a lot to ensure that we get people the freedom that they need right now from detention. And there is a toolkit that was created by the Detention Watch Network. We're really, really grateful for them creating this toolkit that we're also going to be sharing on Facebook. So if you can take a look at the chat and go to that toolkit, and it's basically a guide for people who want to do something at the local level. Perhaps it's really hard to get to ICE headquarters, and it's an entire different situation now under Trump. It's really hard to get to ICE at the federal level. We're going to be continuing to call for them to do the right thing and to release people. But there's many other stakeholders that you can also target. There's members of Congress that you can call to make sure that they're also doing the best they can, sending letters to ICE, putting all the pressure that needs to be put on these elected, they're not even elected officials, these agencies right now that are either still raiding people or raiding homes and also still detaining people. So the toolkit is, again, is the Detention Watch Network. And, please take a look at that. There's also a Spanish version that you're going to find there if you want to share that with any people who are Spanish speakers. And then the last and third thing that I will say is we are looking within Raíces to create a resource guide for the community as far as, what people are asking, whether there's any answers available, right? If people have appointments with immigration, whether people don't know if they can go to the doctor, and it all depends in localities, it depends where you live, but we're trying our best to gather as much information that is needed as possible right now for the immigrant community. So feel free to drop in anything that you think we could possibly be finding as far as resources, and we'll do our best to try to find that information. So you can put that on the chat on Facebook, and we're gonna be keeping that record to look for that type of information to share with you all. So with that said, we have just a few minutes left for from the rest of the hour. We have a lot of questions. Which means that people are really paying attention, and I am really happy that that's the case. We have about 20 questions. We're not going to be able to answer them all because we don't have a lot of time. So I'm just going to go through and ask our panelists some of them. And if you would like to just unmute yourself if there's something that you want to respond. I will say that some of the first questions are around MPP. And whether we're doing anything around MPP. I will say that right now, at least from Raíces, we're still trying to get information from people who are on the ground right now, and what is it that can be done. So from our end, there's not very specific things that we can do or that we're asking folks to do at the moment, outside of getting people released from currently who are in custody. But I'm going to open it up if there's anything that our panelists have heard or anything that you think would be helpful for people who are at the border. And for those of you who don't know what MPP is a migrant protocols. Oh, I can't remember the other P. Migrant protection protocols, and is basically the Remain in Mexico policy that Trump announced. And now there's hundreds, I think at this point, thousands of people who are stuck in Mexico waiting for their asylum case to be processed. So any thoughts from the panelists as far as what folks are going through because of MPP?
So we run a program, Project Lifeline runs an asylum collaborative there with a number of legal services organizations to supply forensic asylum evaluations for people for their asylum cases. So we have clinicians who have been going there from the United States about once a month to do very thorough psychological evaluations that are to support these cases. They have now said from Mexican immigration that they want to limit the volunteers that are coming across. Already the humanitarian aid organizations had decided to limit the number of volunteers coming across who had been traveling. There is a medical relief effort there, the global response management. I was doing actually physician recruiting for them for about 6 months, late last year and early this year. And they just released some information on the really devastatingly inadequate resources that are there to address any surge that might happen in the number of cases that they might see in that kind of setting, where again, much like in immigration detention, all of the basic needs of people are not being adequately met. They are basically, sleeping on top of each other in an outdoor encampment, open air encampment, where they don't have the luxury of socially distancing. And yeah, I mean, in the United States, physicians are talking about how we build for surge capacity in our ICUs in order to make sure that the people who are most severely hit by this illness, it's about 20% of people who will require hospitalization, and about 20% of that 20% that will require ICU care and potentially mechanical ventilation. They don't have ventilators to meet the potential needs of that population there. The encampment has maybe about 1,500 to 2,000 people there still right now. So GRM, as a relief organization, is preparing to try to help address the need, but an infection there will be disastrous. And so we had been calling for the discontinuation of MPP, and I think in light of COVID-19, it's particularly relevant that we not do these really inhumane practices that are going to result in a lot of tragedy.
Thank you. Absolutely. Any other additions before we pass to the next question? Thank you, Donna. That was super helpful. The second question here that I have is, can you please talk about the risk of people with HIV/AIDS in ICE custody, and the risk that they face because of the coronavirus? Also, transgender women, LGBTQ women, people at this time. Any of our panelists have any comments about that?
So for HIV specifically, and I think it's important here to include really any chronic illnesses, it's people who are immunosuppressed, but people who have any kind of cardiac or lung disease, and that is not some exotic cardiac or lung disease. That's as simple as high blood pressure or diabetes. Anybody with these chronic illnesses are at increased risk for poorer outcomes, more severe or critical COVID-19 infection. And the older the patients are as well, or the people are as well, they have increased risk too. And then also we're finding out that the younger the patients are, they have increased risk. So while pediatric, people who are listening may have heard that pediatric patients are relatively protected for some reason. They don't seem to get the infection, at least not severely, nearly as much. The very young, so infants, toddlers, of the children who do get infected, they do the poorest. So when you were talking about CARMS having now many pregnant women, infants, young children, that's a particular concern, I think, because those kids will not do well if they get the infection. And as we discussed before, the odds that they will get an infection in those kinds of environments are infinitely higher. So.
Thank you so much, Donna. Anybody else wants to add anything?
The one thing I was going to add is, just since someone asked about trans folks and LGBTQ folks in detention, is that there's already an abuse of the use of solitary in detention. And because ICE kind of just doesn't know how to handle it. And so instead of releasing people safely, they put them in solitary rather than put them in a unit with either people who are men or women. And so I just feel like here there's an increased reasons to abuse solitary, to identify people as high risk and say that we're protecting them by putting them in solitary. So that's another reason people need to be released.
Thank you, Andrea. Another question is whether we have statistics of detained immigrants in the U.S., where and the count in each center. Are the conditions similar to this Texas facility that you were describing? I don't personally have statistics in front of me. I don't know if any of our panelists do. What I could say is that outside of Texas and New York City, there has also been reports of people going through very similar situation in other detention centers. And so, per our, at least within Raíces, because we have been paying bonds, through our bonds program, we have heard stories from other detention centers. I personally, I'm in Arizona. I've also been hearing a lot of really terrible stories for many, many years from Eloy Detention Center. And just as far as what we know in general from ICE detention is that there's a lack of health services, and just in general, people are mistreated in every sense of the word in so many ways. And so we are very, very concerned for people all across the country who are in immigration detention. And that's why the call is very clear that every immigrant right now should be released, and that ICE should stop their operations in this moment, since the crisis will grow. And we all know that for all of us. And so that's a very clear ask that we're making at the federal level. Anyone else wants to add anything? All right. Let's see. Is there any way, someone is asking if there's any way to support KRYSTLE, if there's, I don't know if BDS, or maybe we can share something later on as far as, how we can support you and your family.
I'm happy to look into that with the family, and if there's something to share, we'll get it to you guys and we'll put it out. Thank you for asking. We really appreciate that.
Perfect. Great. Well, we have a few more minutes, and we have a lot of questions, and we're so grateful for people who tuned in. And I'm just gonna open to see if there's anything that we didn't mention from our panelists that we want to mention before we close. Anything that we didn't talk about? Okay. Well, thank you all so much. Thank you everyone who was watching on Facebook. The video will be still on Facebook for any time to come. So share it with your networks and share the petitions. Again, just follow BDS on Twitter and Facebook. Follow Raíces, Doctors for America, Detention and Watch Network, and all the organizations that are doing this work, because we are going to be updating as we go. We don't have all the answers, but we have a lot to say and a lot of demands to make. So we hope that you can amplify those as much as you can. Thank you all so much. Have a wonderful day. Please take care of one another, and we're all here for you.